morning. I'm Attorney Trixie Cruz-Angeles, former Press Secretary of the Marcos administration.
And I'm Attorney Barry Gutierrez, the spokesperson of former Vice President Leni Robredo.
And we are the Spokes. Overpopulation has been a constant problem of our country, but today a new reality is emerging. Filipinos are having fewer children than ever before.
Just last week, Philippine Statistics Authority released its 2025 National Demographic and Health Survey, showing that the total fertility rate for the last 3 years has reached 1.7 children per woman, a dramatic fall from 4.1 more than 30 years ago in 1993.
To help us understand these numbers and implications, we're honored with the presence of former Executive Director of the Commission on Population and Development.
He retired from CPD in 2022, but he's still active as the current Vice President of the Forum for Family Planning and Development, Dr. Juan Antonio Perez III.
Welcome to the Spokes, Doc GP.
I'm happy to be here.
Welcome, thank you for
Thank you for being here.
Yeah.
Pero interesting, our topic today. But first, you're a doctor.
Yeah.
You specialize in public health administration
Yeah.
and primary health care.
Yeah, I was doing primary health care in urban poor communities
Ah, I see.
when I started my career before joining government.
Did you graduate from UP?
No, UST.
UST.
Medicine.
Nice. I'm not gonna ask when. Could you briefly explain your work as former Executive Director of the Commission on Population and Development?
Well, I joined POPCOM. Well, it was just POPCOM then.
Yeah.
In 2013, late
Okay,
2013. Just at the time when we were supposed to implement the RPRH law. So very interesting times.
The
And the
RH
challenge
law.
was there was a status quo ante order
Yes.
at that time, and we were waiting for the Supreme Court to act on it, no? And it took time.
Yeah.
So during that period, we were focused on implementing the family planning program as it was then, even without the full RH law. So that was the focus of our work at the time. So we became co-managers with the Department of Health in implementing the RH law. And when the status quo ante order was lifted in 2014, we really went full blast to implement that. But we are a devolved agency like the DOH, so we
Okay.
work through local government.
Okay.
So that community-based family planning and working with LGUs was really the core of what we were doing.
You've worked with 9 health secretaries, 3 socio-economic planning secretaries.
Yeah.
So in all that time, that very, very extensive career working on population, what has been one of the chief, what have been the chief concerns regarding our population issue?
Well, I started my work in government under Secretary Johnny Flavier. No? So I served all the secretaries of health up to 2000. And later on, Secretary Duque. Even at that time, Secretary Flavier was already pushing for, a stronger family planning program. And President Ramos at that time was very supportive of it. No? I think he's our first non-Catholic president
Yes.
also.
Yeah,
Yes.
tama.
And he really got Secretary Flavier because of his work at community level, delivering health services. And Secretary Flavier was known for his advocacy on family planning. So that is where I became interested in that work. And of course, over time, we had problems with implementing family planning, particularly with the church opposing family planning programs. And Secretary Flavier was a funny guy. He would say cardinals should have luminous condoms so they could see in the dark, something like that. So He was almost condemned or excommunicated by, I think, Cardinal Sin. So that was his way of pushing it, you know.
Yes.
He was really pushing the envelope. But it took time for the program to really take off. The family planning program, by 2012, when I came in, was only serving 4 million women and couples. No? And that was a very low number because there are 20 million women who potentially can get pregnant or can have children. We were covering only a small portion.
Okay.
So with the when the RPRH law came in, that was our benchmark. From 4 million, we need to grow the family planning program. So by today, 12 years, 14 years after the RH law, there are now more than 8 million women using family planning methods.
Okay.
And if you count traditional methods, that's even more. Around, now we estimate only 12% of women have unmet need for family planning, where before it was 30-40%. No? So
Unmet need meaning they want to avail pero they don't have access.
yes, they don't have access. So that is the remaining gap right now among women who are married or who are living in or cohabiting. No, they still need family planning. There's still that number, and they're usually the ones in rural areas, in what we call geographically isolated, disadvantaged areas, or GIDA areas.
So the Philippines is now at a 1.7 fertility rate.
Yeah.
What does this mean?
Well, it's a long journey.
Okay.
That's what it means.
We have
Because,
time.
if you think about it,
All right.
in 1969, no, I was already around at the time. Yeah, much younger. But
I hope so.
we always compared ourselves with Thailand.
Okay.
Okay.
In 1969, we had similar population.
All right.
We had 69 million. Thailand had around 67 million.
Okay.
Same. But development-wise, we were behind Thailand. Thailand was more economically backward at the time. And we were a bit more advanced. 65 years later,
Yes,
Thailand has 71 million population.
69. No.
57 years.
57.
Ah, 57?
57.
Yes.
I did not take math too well. So, 57 years after, Thailand is 71 point something, almost 72 million. We are 112 million. So, we grew an entire country to add to the population we had. So, the pressure on the economy, on government, to deliver services,
Yes.
to expand education, health, has always been there all that time. And we seem to be, in a way, really a laggard in terms of fertility. And because we were not doing it right in terms of delivering on health, family planning. And in 1993, while Thailand was already at 2.1, below 2.1 fertility rate, we were still at 4. Double
Yeah, up
what
to
Thailand fertility was. And that really caused the growth of our population.
Doc JP, just to be clear, what does fertility rate actually refer to? When we say 1.7, 4, what does that mean?
Well, we use total fertility rate as the number of children a woman will have in her lifetime.
All right.
Okay.
So, that's important because kung nasa 2.1 children, that means the couple, lalaki, babae, will have 2 children to replace them.
Yes.
So, we call that replacement rate.
Yes.
The population will not grow.
Yes.
But if you go higher than 2.1, we were at 4. That means nagdo-double ang
Nagdodoble.
population mo.
Yes.
And your government has to really catch up. No? Put more maternities, more classrooms, no?
Yeah, of course.
Find more jobs for people as they enter the working age, no? And a lot of other social services along with that. Infrastructure has to catch up. So government has always been looking at fertility rate as a measure of, a foundation for our improving economy. If you don't get that 2.1 fertility rate, you will always be catching up. You'll never be able to really get there. And it was really a big relief to government and probably to the Marcos administration that it was told that in 2022, the fertility rate is now 1.9. It went below the total fertility rate, what we call replacement rate. And it was a steep decline. Some people, PSA calls it a steady decline. But really, the decline was, we went from 3 children in 2013 to 1.9 children in 2022, and now 1.7 in 2025, 24 actually.
Wow.
So 1.3 children, we had that much more, less number of, traditionally we call it mouths to feed, etc. So it's really an advantage for a government to have this demographic picture.
When did the decline begin? You say it was a steep one. So did you see this happening?
Well, actually, looking at it in hindsight, no?
Yes.
We always link nuptiality or marriage to population growth.
Of course.
Understandably.
So people will get married first before they have children.
Having children. And the height of our nuptiality was in 2003.
Okay.
593,000 couples got married that year.
I got married in 2003. So
You contributed to that. So that was the peak of marriage in this country.
Okay.
From that time on, it's been downhill.
Okay.
And it's been going down steadily, went to 400,000. And the lowest was in 2021, during COVID.
Okay,
Only
understandably.
240,000 got married. It recovered after COVID.
Of course.
Pero now it's still going down. We now have only 320,000 getting married. So that's a sign that the population will be going down.
Okay.
That was an early sign. Of course, at that time, we didn't know it. We were in the middle of it. But looking back, that was probably when the decline started. And mainly because women were choosing not to have as many children by postponing marriage, for example.
Okay.
So currently, more than half of our 57.3% women who are married do not want more children. 7 out of 10 married women demand for family planning.
Yeah.
This reflects, I assume the RH law had something to do with this?
Well, both the RH law, because family planning has become more available.
Yes.
But on top of that, because of the economic situation, and that's partly the reason why there's less marriage, because of thinking cost of education, bringing up a child, etc. Because of that, women started to think about having fewer children and postponing marriage. So what we saw was the number of women getting pregnant. The height is 20 to 24.
That's older.
No, that's a bit young.
That's still young?
Yeah, because at 20 to 24,
tayo.
your
Tama.
job is not,
Still
you don't have a good paying job.
All right. And
You
you still need
have-
advice,
So they
parental advice.
They want to postpone having children and probably marriage.
Yes.
So if you don't get married at 20 to 24, you get married at somewhere 25 to 29.
Alright.
Late 20s. Yeah.
When you have a better job.
Mas stable na kayo.
Stable.
Yeah, so women have been actively delaying
Alright.
fertility and marriage.
Okay.
And that's what we've seen. So that delay has moved fertility to 25 to 29, and also women not having as many children because you get
You,
get
you
it
have them later.
We also have economic findings that from some studies in UP Population Institute and UNFPA that to support a family, both husband and wife have to work. Because the minimum wage we have here
Okay.
will support another child only and the worker. So if you have one child and you have a wife, that's not enough.
So
If you have a second child, the wife has to work
yeah.
to support that if you're at minimum wage.
Yes.
Okay.
So that reality has made postponement of fertility, not having so many children.
So may economic ano rin talaga, there's an economic consideration.
Yes. You now need to have 2 jobs. Actually, when we were looking at the ratio, in some areas of the Philippines, you need 4 jobs to support 2 children.
4 jobs.
Yes, because the minimum,
minimum
wage,
wage.
because the minimum wage in BARM, for example,
nagbabari
or
per
in
region.
rural areas, is 1/2 that of Metro Manila. So, kung ang kinikita mo lang ay napakababa, you really make choices
Okay.
not to have children, to postpone marriage. So all of this has driven that.
Okay.
So couples now need family planning to to make sure that happens, that they can postpone fertility. So they use more and more family planning to delay. Not to really limit, but to delay fertility. But that delay sometimes leads to fewer children, and that's what we're seeing.
You mentioned earlier that we're currently below replacement rate so
Yeah.
far as yung fertility statistics are concerned. Should this be a cause of concern for the government, for the Philippines in general?
Well, right now, our population is still growing by about between 800,000 to 1 million a year. So we're still growing. The 1.7 fertility, or even our growth rate is 0.8, we're still growing, and we will continue to grow. We actually have a working age population, which is 15 to 64,
Yeah.
which is 63% of our population.
Yeah.
So we have a large workforce.
Yeah.
Ito yung tinatawag na advantage ng ating
The
demographic.
demographic sweet spot.
Yes, we are there. But the reality is we have to have policies. So the men are working, maybe 70% of those, 80% are working. But as I said, both husband and wife have to work. And only 50% of women have jobs or are in the labor force. And even if you are in the labor force and the minimum wage is below poverty line, that's a problem.
Yeah.
So we really have to think about our wage policies, the fact that demographic realities are telling us husband and wife have to work even to support 1 or 2 children. If you have more than 2, it's really a problem. So really the population has declined because of economic reality, delayed marriage, family planning is now more available. So those are the main reasons.
Is this a global development then?
Oh yeah. Now the worldwide, the fertility global is 2.2.
So we're below that.
We are below.
Okay.
Yeah, in Asia, I think we're below 2. So we're actually behind some of these countries. We're on par with Malaysia. At 1.6 ang Malaysia. Thailand is 1.2. Mas mababa pa ang Thailand.
The same low tayo as the US?
Yeah, about the same.
1.7.
We have about the same fertility rate as the US, but we have lower employment.
Yes.
And the cost of healthcare is so much more, education, etc. So the choices are more limited for couples right now.
So, but wait, did we discuss how is this happening? Have you figured out what are the factors that are leading to this decline and a steep decline?
Yeah.
Yeah.
Yeah, the major factors, there was a study that came out after the 2022 National Demographic Health Survey. The biggest factor for the steep decline is marriage.
Again.
Decline in marriage. If you have fewer marriages, fewer unions, fewer children.
Okay.
That's the biggest factor. The second factor is actually between family planning being available because of the RH law,
Yeah.
but also there is people have sex less. There's less sex in the bedroom. And the fourth reason is, that's in the survey. The fourth reason is women are choosing to have fewer children.
Okay.
So it's a women's choice. So those are the four factors that have led to this steep decline.
I'm still at, people are having less sex. I can't get past it.
Would you care to
Wait.
speculate?
Well, I'm not a sociologist. But I guess it's because if you're in the labor force,
Okay.
if you have stress in economically, family, I think that probably leads to that, no?
Okay.
And I remember during COVID, we thought that couples would have more sex.
Because they're stuck at
Because they're at
home.
home.
Yeah.
Yes.
It didn't happen. They were there, but they were not doing it. So the population growth, actually in 2021, during COVID, went down.
Wow.
And that contributed, COVID, that period, contributed to this decline. No? It accelerated the decline.
Why is the Calabarzon is registering the highest drop at 1.3%. We'll need you to discuss this when we get back after this short break.
The Spokes is back, still with Dr. G.P. Perez. Our hanging question, why is Calabarzon registering the highest drop at 1.3%?
Yeah, Calabarzon is now our most populous region. And it's also, I think, one of the regions that's almost 100% urban.
Okay.
Because our country is urbanizing at a very rapid rate.
Okay.
I think those are contributing to lower fertility. The fact that Calabarzon is also the place where many Filipinos go to. Migration from the
Yes.
provinces.
Yes.
It's not to Metro Manila,
But
it's to Calabarzon. So you have a lot of economic activity, poverty is low. So in that situation where you have a good economic situation, fertility is bound to go down. NCR used to be the one with the lowest fertility because of its economic activity, also urbanized. So, and when you have that situation, you also have services available. No? More education, more health services, family planning is there. So all of these factors are probably contributing to that.
So-
But they could look deeper into it. No? Maybe they should look at by province. No? Which provinces have the...
you get more specific answers.
Yeah, Cavite probably is one of the, I think, provinces where poverty is lowest.
Okay.
And they probably have the lowest fertility because of that.
So, ang highest fertility rate naman is nasa Barm
Yeah.
at 2.4, pero galing
Bumaba na
siyang
rin. Bumaba na
3.1.
rin.
Yeah, it's declined, yeah. And, well, there are a couple of factors there. In Barm, couples get married earlier. Arranged marriages are still there. There is also some resistance from some conservative clerics in Barm that family planning is haram. No, it's not. They look at some of them look at tubal ligation, for example, in women as a kind of mutilation because of their conservative. But there are also very progressive thinkers there. But still, the reality is, the economic reality is, families are largest. You have large families in Burma. I think it's 4. So there is, I think culturally, parents want to marry off their children as early as possible because to ease the burden on the family, the economic burden. So we've seen that we have a child marriage law, no, that bans child marriage.
Yes.
BARM has not been asking for wag muna natin implement to.
Okay.
Because of that reality. You have younger marriages there. So that's a situation that we hope will improve over time. No, that the BARM government will make family planning fully available services to couples that want it. There's no forcing of we don't have a one-child policy. But what we want to address is the need of women for family planning, sexual reproductive health services. Sana mas available yun.
Isang related na statistic dito, Doc JP, is yung sa teenage pregnancy. It's also gone down. Di ba? Bumaba from about 10% to about 4.8. But earlier, nag-uusap tayo, nagkukwento kayo about there's something going counter to the trend. And this is with respect to pregnancies of women below 16. Tama ba?
Yeah. Actually, if you look at the birth rates, adolescent birth rate, we call it, yung between 10 years old to 19 years old. Actually, yung 10 is not adolescent, pre-adolescent.
Yeah.
Yes.
No? If you look at that, it's going down.
Okay.
From around 200,000 plus, it's now around 150,000 na lang.
Okay.
But if you look deeper, you look at those 10 to 14, and CPD, Commission on Population and Development, recently came out with the numbers, and they said, yung 10 to 14 is growing, number of pregnancies. The youngest in 2024 was a 10-year-old, a couple. Actually, 2 years before that, there was an 8-year-old that gave birth. So you have younger and younger children getting pregnant, and the numbers are increasing. No? It increased by 8% from, or 7% from 2023 to 2024.
So pregnancies to of women below 14?
Below 15.
Below 15?
Now, if you look at the number below 16, the number is 12,000.
Okay.
Yung 10 to 14 is 3,000. Idagdag mo yung 15 to below 16, that's another 8,000. 11,000 to 12,000 are giving birth.
Wow.
That's
Now,
a crime statistic.
Actually,
Yeah.
that's statutory, right?
Yeah, in 2022, we passed the anti-rape law. The statutory rape law, which is an amendment.
Increases yung age,
Yeah, so now, it's rape if you have relations with someone below 16.
Regardless of consent, yes.
Yes.
Yeah, so if there is a pregnancy that's increasing from 10 to below 16, that's, I think, considered automatically possible statutory rape.
Yeah.
Yes.
There are exceptions, no?
Yeah, pag within
3
3 years.
Yes.
And but below 13, walang exception.
Yeah.
Also, what we've seen is DepEd was supposed to do something about this. No? The law says DepEd should issue guidelines to improve the curriculum to protect girls from abuse, and teachers should be trained to detect abuse because they're the ones who see their learners. Almost more than 90% of our school-age children are there with the teachers. So teachers have a big role, both in public and private. So the law asks them to do something about this. But nothing has been done yet, except sending a memo that this is the law.
Okay.
So there are many measures to do something about this. One is comprehensive sexuality education. which is now called reproductive health education per the RPRH law.
Yes.
We also need to provide services so they don't get pregnant again. Because
Yes.
if you're so young, you can get pregnant again. So you need to provide services to them if they want it. It's all voluntary, nothing forced. But it should be made available. But the Supreme Court said that you cannot provide services to adolescents, even if they are married, or no, they cannot be married. Even if they have had children, they had a miscarriage, or they are pregnant,
That's in the decision.
yes,
Yes.
you have to get the consent
Parental consent.
of parents.
Oh, that's right.
Treated kasi as minors.
Correct.
Yeah. So that's why in 2018 or 2019, Secretary Pernia, who was my chair in POPCOM of NEDA, said it's a national and social emergency because the trend was coming from 10 years ago. We could see it. So he said it's a national and social emergency, the number of teen pregnancies.
Grabe, ano?
And that's probably the trigger for the laws that have been, the bills that have been proposed to address adolescent pregnancy. Unfortunately, it got side-railed last year
Yeah.
because the issue of education. But education is only one. You have to provide services. You have to address the abuse, which is the the statutory rape. You have to address the economic needs of mothers who are minors below 18. And you have to mobilize the young people. So there's a lot of things to be done. And that's what the law would have done, but it's been sidetracked.
So, with the steep decline in population, are we heading towards an aging society, or is it too early to tell?
Well, actually, the UP Population Institute is pretty sure we will become an aging society next year.
Wow, sooner than I expected. But
Yeah, the threshold is if 10% of the population is over 60, your population is starting to age. It's in the early period, but it begins in 27 because we will hit 10% next year. Of the 10% who are 60 and above, 7.5% are over 65. So a
Okay.
large number is over 65. That number will continue growing probably to about 15% by 2035 or so. There will be a kind of, we have larger, older populations and fewer young children, 0 to 5, because of the declining. But it's still growing, population is still growing. But in terms of dependency, ibig sabihin na the number of older people who depend on the working population and children who depend on the, medyo lalaki yung older population.
Okay.
And that's a problem in terms of health, financing.
yes.
Yeah.
Because right now, PhilHealth is paying out more than 30% of its resources to older people who get sick.
So that's going to increase dahil nga.
That will, and not all of them are going to hospital pa. So the health needs of the older population is going to grow.
Well, not to mention Social Security.
Yeah.
It's going to be a problem.
We only have 20% of the population with Social Security.
Yeah.
And if you check how much that Social Security is from SSS,
It's very small.
It's
SSS.
That's why people are pushing
4,000
for
is the low
universal
amount.
social pension.
So, does this mean na kailangan na natin baguhin yung approach? Is it time to offer incentives, for example, for people to have children like other countries are already doing?
I think we have to be, we have to really think about what this demographic dividend is offering us. No?
Okay.
Because we are on the brink of growing old before we become rich as a country. No? So what we want to do is become rich before we start aging. So how do we become richer? No? And it's really part of the solution is allowing, because of this demographic dividend, women, fewer children, no? Women have more time. You're freed
Yes,
from domestic chores, no? Or, I mean, I know it's a bit anti-gender equality
Sensitivity.
to say that ang domestic chores are done by women alone, no?
It's still a
men have to
reality, though,
contribute.
yeah.
It still is.
Yeah.
But
Except
the reality
Attorney
is,
Barry.
oh yeah,
He's
you're
an
right.
exception. He
But-
cleaned house last Holy Week.
This is an opportunity for women to start joining the labor force. And, to move up from 50%, below 50%, to a higher number. Because it's been shown that, well, economically, I said, both couples have to be working to support 2 children. And if you have 1.7 children, that averages out to 2. So the both of you have to work.
Okay.
So we need to have more policies that support women to work. We need to have policies that will improve the Human Development Index. Ano yung Human Development Index? Sabi ng World Bank, a baby born today, will only achieve 52% of its potential in the Philippines. Only 52%. That's because we have such, our life expectancy is low. Tatlo lang naman measure dyan, life expectancy. We are at around 72. Worldwide, it's more than 80. Education, mean number of years in school, we are at around 9. It should be around 12. And what's this, GDP per capita? We're very low. So poverty, education, and health, all of these areas have to be addressed by the country. More investment in better education, more investment in health of the young people. So we have to have a youth-looking policy to improve the potential. We're not talking about those who were born 10 years ago. We're looking forward. That's a dividend that we can gain on top of the current potential dividend. So may mga second dividend pa yan. Actually, Thailand started to have a good policy, and since 1990, gumanda economy ng Thailand. They got all the dividends, and they're now thinking of how to extend that dividend. No? And the first dividend is more people at work, more productive. The second dividend is yung young people. We invest more in young people so they get better jobs. They're more attuned to the needs of the economy in the future. That investment needs to be done now.
You just gave me a lot of questions for potential candidates.
Sige, tanungin mo sila.
We're at that part of our program where we ask tough questions.
Parang hindi tough question yung kanina.
Always. So, tough question number 1. The Catholic Church has long opposed artificial birth control. Does this trend show that Filipinos are moving away from traditional religious teaching?
I think even before the RH law passed, people were choosing family planning and not really listening. I know Barry knows this, no? That the people always thought that they needed the services.
Yeah.
That's why it got so much support. So,
Especially at the
however,
community level.
yeah, when you talk to urban poor communities, they really want it. But the law itself said that we joined the health issue of reproductive health with responsible parenthood. No, that is what the Constitution says, and I think the Church agrees with that. And even the Pope said, you should not be breeding like rabbits. You should. Diba?
Not sure if he said it that way, but yeah,
something to
close,
that
very
effect.
close,
Yeah,
very
no?
close.
So that's why the Church has always supported, and I've worked with them when I was in POPCOM, on natural family planning, to expand that. But natural family planning is only 3% of the methods being used. Okay. The biggest is lactational amenorrhea, which is breastfeeding.
Okay.
So we really support that. But since the law was clarified, FDA actually said, hindi abortifacient ang family planning. That was the objection of the church. The IUD is abortifacient. The FDA said, according to studies everywhere, it's not.
All right.
Pills do not cause cancer. Pills actually help in other health conditions, like PCOS, polycystic ovarian syndrome. And the implants or the injections are lower doses than the pills over time. So they're not that problematic. And surgical methods, more and more women are doing tubal ligation. It's the men that are not doing vasectomies. It's very low.
Okay,
So those things are problems.
second tough question, Dr. JP. Is this really about a choice or is it a failure of government to create an economy where people can afford to have more children?
Well, let me put it this way. We aimed for replacement fertility in 2000. When I was in 1992.
So,
that's when I started.
The 2.0 na ano, yeah.
We wanted to move from 4 fertility of 4 children to 2 by 2000. We never got there. So partly, I would say governance is a problem. That's why it took some time for us to get to a level of fertility that makes it more comfortable for government to provide services. On the other hand, even that early, women wanted to have fewer children. So we did not address that choice, that need for choice. So a failure to address choice and a bit failure of governance also.
Okay. Thank you, Dr. GP, for this very enlightening conversation. We touched on so many issues.
Thank you.
The spokes will return after this short break. Unnoted by the spokes, this Friday, President Ferdinand Marcos Jr. has approved a 10 peso per liter fuel subsidy for public utility vehicles.
Happy na ba tayo dapat?
I would have been happier if we did it 2 weeks ago.
Actually, di ba? Tsaka at this point, 10 pesos is a drop in the bucket. Yeah.
We don't know. A lot of, marami dun sa mga jeepney drivers natin, di na namamasada. Dahil dito sa dahil sa mahal ng gasolina.
Pero balita ko may rollback daw next week, di ba? Pero magkano? 350?
So, ay 2 pesos daw.
2 pesos?
Holy cow. So, but with the 10 peso subsidy,
well, kahit paano naman.
may konting breathing space, at least yung public utilities.
In fact, feeling ko, matagal nang sabi mo nga kanina, this has been something na matagal nang hinihingi ng mga namamasada.
Kasi nga, sinuspend lang yung fare hike imbis na mag-subsidy dun sa But sige, sure.
So, hopefully, the 10 peso subsidy plus merong konting rollback next week, kahit papaano hindi kasing sakit, pero obviously it doesn't cover
We still need a
increase.
longer-term solution. Hindi natin alam kailan matatapos yung giyera.
Tsaka how long can they sustain subsidies?
Isa pa yan. Parang ang yaman natin, lalong-lalo na after all the maletas. The disparity, oo. Di ba? Yung
magkano na tinaas ng gasolina at diesel
3,
this
diba?
past few weeks?
Di ba we were expecting it abot ng 170? At ang predictions were supposed to be, baka umabot ng 200. Pag umabot ng 200, maglalakad na ako.
Kung umabot ng 200, may rollback naman daw na piso. So, 190.
Wow! Salamat!
Thank you, di ba?
Salamat sa pakikinig sa amin.
There will be implementation challenges for the fuel subsidy, obviously, for yung PUVs din. Paano yung actual distribution? Paano yung targeting?
Oo nga, no?
Di ba?
So, do they get booklet? Oh my gosh.
Diba?
Nightmare
Dati
na
nagkaroon
naman
ng parang
Dati may
card.
booklets
May card.
or cards.
May card.
Oo nga pala, di ba? The infamous swipe cards.
Yeah.
So, okay. Well, let's see. Let's see how they do it bago natin i-bash.
Oo nga. Pero ang point ko lang, hindi ba dapat ngayon pa lang
Dapat
pagka-announce, sinasabi na paano
Oo.
i-implement?
But siguro dapat nasasanay na rin tayo sa style nila. After all, pasalamat tayo. Ngayon may subsidy na.
Oo naman. Yeah. Okay. Our next noted by the spokes, Vice President Sara Duterte says she has no official Senate slate yet for the 2028 elections.
Well, sabi niya, nahihirapan daw siya to put together a slate. Sa bagay, kasi kung maaga rin naman malaman
Totoo naman.
na daming nakaabang
Tsaka, alam mo naman sa bansang ito di ba? Habang malayo-layo pa eleksyon, and the fact of the matter is more than 2 years pa yung eleksyon. Siyempre, hindi mo masyadong gustong umangat ka agad. Baka bariling ka.
Correct. Di ba yung umaangat, yun yung nababato? So, ayaw pang mabato ng mga tao. I assume that, and I think reasonable naman yon. So there's nothing, I don't see anything wrong with her saying na wala pang slate. It's also possible na meron na siyang nasa isip niya, hindi na lang niya i-announce. The same way, hindi na siya nag-announce ng nung nakausap niya maging vice presidential candidate niya. Mababato din yan.
At saka, quite honestly, siya pa lang naman na nagdideklara openly na tatakbo siyang presidente. So, I don't think na the non-announcement of a Senate slate is an issue this early diba, in the conversation.
Pwede rin na nagko-consolidate siya ng allies niya.
So, tahimik na gumagalaw.
Ideally, kasi in this age, sa social media age, yung bardagulan sa social media.
Given yung, open conflict na talaga between si VP Sara and the administration.
Yes.
Meron ding aspect dyan na mag-iingat ka.
Correct. Kumbaga, manage your information.
Yeah.
Tingin ko kahit paano, meron na siyang napupusuan sa Senate. Pero dun sa kumbaga, minamanage na lang niya na wag na munang sabihin.
Ako, honestly, maaga pa. Madami pang mangyayari dyan.
So, pero interesting yun kung may coalition building na siya. Kasi nakikita natin may mga parties, di ba? Na hindi na interested sa impeachment, di ba? Or, up to the individual consciences. Tingin ko that's indicative then of their willingness to talk towards coalition building.
Yeah.
Kasi yung iba may may open statements na no longer interested. So I think that's with an eye towards the next elections.
Yeah, definitely. Okay.
These are the headlines noted by the spokes today.
The falling birth rate isn't just about numbers. It's about whether Filipinos can still afford to build families.
From overpopulation to underpopulation, the real question now is, are we shaping our future or drifting into it? I'm former Press Secretary Attorney Trixie Cruz-Angeles.
And I'm former VP spokesperson, Attorney Gutierrez.
And we are the spokes.